What to know about arrhythmia? An arrhythmia is an irregular heartbeat. An arrhythmia may feel like a racing heart or fluttering. It is not always serious, but can sometimes indicate a potentially fatal heart problem. If you are new on our channel, then please subscribe our channel. It will be support for us. Now we move towards our topic. Types. There are several types of arrhythmia. 1. Atrial fibrillation. Afib is the irregular beating of the atrial chambers and nearly always involves tachycardia. Afib is common and mainly develops in adults over 65 years of age. 2. Atrial flutter. While fibrillation causes many random and different quivers in the atrium, atrial flutter can be a serious condition and usually leads to fibrillation without treatment. Some people may experience both flutter and fibrillation. 3. Supraventricular tachycardia. Supraventricular tachycardia refers to a rapid heartbeat that begins in the upper chambers of the heart. It prevents blood from filling the heart's chambers fully between contractions. 4. Ventricular tachycardia. Ventricular tachycardia, VT, refers to abnormal electrical impulses that start in the lower chambers and cause an abnormally fast heartbeat. 5. Ventricular fibrillation. Ventricular fibrillation is an irregular heart rhythm consisting of rapid, uncoordinated, and fluttering contractions of the ventricles. A heart attack often triggers it. 6. Bradycardia. Bradycardia is when the heart rhythm is slower than usual. It happens when there is a problem with the sinoatrial node, the heart's natural pacemaker. 7. Long quart syndrome. Long quart syndrome refers to a heart rhythm disorder that a person is born with. It sometimes causes rapid, uncoordinated heartbeats. It can be life-threatening and causes a rhythm known as quart prolongation. Symptoms. The symptoms include 1. Breathlessness. 2. Dizziness. 3. Fluttering in the chest, known as heart palpitations. 4. Chest pain. 5. Tiredness. 6. Breathlessness. 7. Palpitations. 8. Fainting or nearly fainting. 9. Weakness. Causes. Any interruption to the electrical impulses that stimulate heart contractions may cause arrhythmia. This usually results from 1. A problem with the electrical signals that control the heartbeat. 2. Damage to heart tissue. 3. A high level of strain or stress. 4. An imbalance of fluids or electrolytes in the blood. 5. Changes in hormone levels. 6. Some medications. Diagnosis. To diagnose arrhythmia, a doctor will need to identify the unusual heartbeat and try to find the source of the change. A doctor may also recommend 1. Blood and urine tests. 2. An electrocardiogram, EKG or ECG. 3. A Holter monitor, a wearable device to record the heart rhythms. 4. An electrophysiology study to measure electrical activity in the heart. 5. A tilt table test to help identify if sudden decreases in blood pressure or heart rate are the cause. 6. Genetic testing, in some cases. 7. Heart imaging tests, for instance, a CT or MRI scan. Complications. Some people with arrhythmia do not experience active symptoms. However, treatment is still essential because life-threatening complications can arise, such as a stroke and heart failure. Stroke. Afib means that the heart is not pumping effectively. This can cause blood to collect in pools and form clots. If a clot dislodges, it may travel to a brain artery, causing a potentially fatal blockage, or stroke. Stroke can cause brain damage and require emergency treatment. Heart failure. Prolonged tachycardia or bradycardia can result in heart failure. When the heart fails, it cannot pump enough blood to the body and its organs. Treatment can usually help improve this. Heart attack. A heart attack happens when blood stops flowing to a part of the heart muscle. Without oxygen, the heart cells will begin to die. It can lead to cardiac arrest. Cardiac arrest. A cardiac arrest is when the heart suddenly stops working. Blood is unable to flow to the brain and other organs. Within minutes, damage will start to occur due to the lack of oxygen. Prevention. It is not always possible to prevent heart problems, including arrhythmia. Steps a person can take to reduce their risk include: 1. Seeking help for any underlying condition and following the treatment plan. 2. Doing regular exercise. 3. Avoiding the use of tobacco and recreational drugs. 4. Limiting alcohol consumption. 5. Checking with a doctor before using any medications or supplements. 6. Following a varied and nutritious diet. Is arrhythmia serious? It is not always serious, but it can indicate an underlying heart problem or a higher risk of a stroke or heart attack. Anyone with signs of arrhythmia should seek medical advice and follow the recommended treatment plan. What are the warning signs of arrhythmia? This will depend on the type of arrhythmia, but common warning signs include fatigue, dizziness, fainting, palpitations or pounding in the chest, shortness of breath, and sweating. Some people have no symptoms, but routine examinations reveal an unusual heartbeat. Comment below if you know something extra because it will be very beneficial for us.